I've been talking to many professionals that are really trying to make this connection. And every time we talk about these topics that, the mouth is connected to the body is connected to the mouth. It makes no sense to divide. Dentistry has very little integration with the medical world, and medical world knows very, very little about what we do on our side. It sounds ridiculous. It sounds so obvious that we need this integration. And 3, 2, 1, and we are back with Coffee Break with Coachman, where I bring some of the most brilliant minds in the world of dentistry, people that inspired me, people that taught me important lessons, people that have something to share, that really want to help dentistry become something even better. And today, another special guest, somebody that I heard for the first time in a TED Talk. I really loved her topic and the way she explained how she sees dentistry and how she's pushing dentistry beyond the traditional boundaries. And as you guys know, I've been talking about these topics of health dentistry, proactive dentistry, biological dentistry, systemic dentistry, the oral systemic link, how to go beyond the obvious, and moving away from just reactive care and doing much better for our patients. And Suzie is an expert on that. And I'm sure we're going to have an amazing conversation here and learn from her. And I just want to thank you, Suzie, for joining me.
Thank you so much for having me. It's an honor.
And I just want to go first, curiosity. How did you get into TED Talk? Because we don't have many dentists talking at TED Talk or giving TED Talks. And I think it's just an amazing, I love TED Talk in general. And I love the fact that you were there giving an amazing message about dentistry, changing people's perception of dentistry. So how did you get this opportunity?
So that's a great question that a lot of people have asked me. I was speaking with a friend of mine who's actually he's becoming kind of a mentor for me, and I was telling him my story, which you watch the talk. I have kind of it's like a water cooler story, or a party story. Like, oh, guess what? One time my friend ran over me with her car and he said, wow, you should do a TED Talk. And at the time when he said that to me, I thought, oh, wouldn't that be so fantastic? Like, how does anyone ever get to do a TED Talk? So I just happened to mention it to another friend who had done one. And this is TEDx, actually, which is independently operated from the big TED, but they have locations around the globe. And she said, you need to meet my coach. So I met this coach, Cesar Cervantes. He's absolutely amazing for anyone who wants to get involved in something like this. And it just happened so quickly. I mean, I started the process in February, and by I think it was April, I had something scheduled. I went to Alberta, Canada with 2 of my adult children, and it was just an amazing experience.
I can imagine.
So I think it's not as hard as a lot of people think it is. If you have an idea worth spreading,
Yeah.
that's what it's all about, is spreading ideas.
Yeah. I think it's not that hard if you have a topic that you're confident and it's going to help people, right? When you're there saying a story that will help people, I think it gives you enough confidence. Even if you're not a professional speaker, if you don't have super training, but you did great. You really did
Thank
great. I
you.
know. Did you have like in terms of not about the topic because you're an expert on the topic, but what about the communication skills? How did you prepare yourself? Because the shorter the lecture, the more difficult, right? And TED Talk, the
Yes.
challenge is like 10, 15 minutes. You have to nail it, every word. You just need to be very precise.
Yeah, so you have to know it backwards and forwards. You can't wing it, you know. And I have a little background in theater,
Okay.
so that kind of makes me comfortable on stage. But the other thing was my kids had to listen to it, my staff, my husband. My husband probably could have memorized it, you know, because he heard it so often.
Uh-huh.
And the other thing is that this is kind of what I live and breathe, you know.
Yeah.
I'm so passionate about this topic, and I always knew that my story would, there's a quote by Brene Brown where she says, one day you will tell the story of what you overcame, and it
Hmm.
can become someone's survival guide. I'm
Yes.
paraphrasing a little
Yes.
bit, but
Yes.
I always knew that that story would have the ability to get people's attention for something
Hmm.
that is really, it really needs, um,
Yeah.
to be shouted from the rooftop,
Yes.
you know?
So, so what is this thing? You said, I love this topic. So explain to us the definition of this topic. What do you mean with
Okay.
this topic?
Yes. So it's really my focus is on integration of medicine, dentistry, and behavioral health. And I believe that in the US in the 1800s, when dentistry became separate from medicine, and there was a dental school that started in Baltimore, Maryland, the idea really wasn't for us to take the mouth outside of the body. That was an unfortunate sequelae of
Mm.
separating us as
Yep.
different professions, you know. So
Hmm.
so like you hear people say, I'm going to the doctor or I'm going to the dentist. But
Hmm.
the dentist is also a doctor, and we are, you know, we are I like to say that we're the orthopedists of the masticatory system. So
Hmm.
we have to know the whole body and how what we are doing interacts. And we also see things that we need to be able to share with
Hmm.
our medical counterparts, and we need to communicate with one another.
I hope you're enjoying the podcast, but I want to ask your permission for a little break. I want to introduce you to my two new courses: Optimizing Clinical Outcomes with John Coyce and myself, Christian Coachman, and Designing Smiles with me as well. On the course with John Coyce, John and I will share the newest strategies on how to become an advanced digital dentist. On the Designing Smile course with me, it's the first ever course with hands on, sharing everything I know about how to master smile design skills. Hope to see you there. I've been talking to many professionals that are really trying to make this connection. And every time we talk about these topics, that, the mouth is connected to the body is connected to the mouth. It makes no sense to divide. Dentistry has very little integration with the medical world, and medical world knows very, very little about what we do on our side. It sounds ridiculous. It sounds so obvious that we need this integration. You are a dentist, your husband is a dentist. You had, as a medical professional, a healthcare provider yourself, you had a problem that was misdiagnosed, and then you were all over, and we are inside, and we were making the mistake from inside. Why do you think something so obvious is not explored properly? Why do you think this topic's like, wow, this is so new or so different,
Yeah. Well, I think that's a really interesting thing for us to explore, because it should be, like you said, so obvious. But when in my case, I had a terrible accident. I was
Mm.
taken to the emergency department. The doctor saw a little burn on my ankle where the muffler had landed on my ankle. And so he was looking at my ankle, you know, and he asked me a few questions, and it seemed like I was okay, and he just sent me on my way. In truth, I had bleeding inside my joints. I had hit my head so hard that the discs had been anteriorly displaced, and there were all kinds of problems that
Mhm.
had I had early intervention, I would have had a completely different outcome. But what we do, I think, in dentistry and in medicine is we compartmentalize so
Mhm.
much that we get tunnel vision, you know?
Mhm.
So
Mhm.
I see this all the time. I'm here in the neurosurgery department at the university today, and weekly, we see patients who, well, like we had someone last week who had an abscess tooth, and he was referred to the neurosurgery department because he was pointing to his face and saying it hurts so bad here. But he
Mhm.
was in a medical office when he said that. And so
Mhm.
the neurologist said, well, if this hurts, you must have a nerve problem and you need to go see the neurosurgeon.
Mhm. Mhm. No, it's insane. And today we see, I talk a lot about how we need to reinvent the first appointment at the dentist and create a new standard of first appointment of exploration. I also talk about the fact that, as you said, we love to specialize and we love to deep dive into what we love more and more. And we are missing the big picture. We are missing the thought organizers, the connectors, right? The ones that are seeing beyond. And and dental school is all about becoming better, picking something and becoming better and better and better on that something. Unfortunately, we see many more great clinicians than we see great diagnosticians. And we're
Absolutely.
missing that so much. Where do you think people can how did you find more about it? How did you become an expert on that? Where did you find the information? Where did you study it? Who helped you? Who mentored you uh, to become a professional that sees the big picture better?
I think part of the way that it happened for me, which is a little unusual, is that I was suffering, and so I had a reason to go searching for answers. And what I learned is that we, I don't know what dental school is like in other countries, but here in the United States, we spend a lot of time on things that we may not be doing in the
Mhm.
future in our career. And we don't get enough training about this joint that's necessary for life, right?
Mhm.
And so I had to study on my own.
Mhm.
I didn't do a residency program, but I studied under some of the greats like Dr. Jeff Okeson and
Mhm.
others who teach about the temporomandibular joint and how it relates to the rest of our body and how there are
Mhm.
chronic overlapping pain conditions. And
Mhm.
because I was experiencing many of these,
Mhm.
I couldn't chew well, so I developed gastrointestinal issues. I just started to explore and meet
Mhm.
people. And, during the pandemic, when we were all stuck inside our houses,
Mhm.
we got to meet so many people from
Yeah.
around the world,
Yeah.
all of a
Mhm.
sudden Zoom became a norm for us.
Mhm.
And
Mhm.
so, even though I had been treating patients
Mhm.
with these disorders for many years, in 2012, I was sitting in a lecture with my late mentor who passed away. And he said this quote that I quote very often that says, natural law did not divide us into three parts, dental, medical, and psychological. And if society chose this division for the purpose of healthcare delivery, then
Mhm.
each professional group bears a special responsibility to be sufficiently trained about the others so that total integrated care is an achievable goal.
I I
And
love.
that was like a light bulb moment for
Uh-huh.
me. So
Uh-huh.
at that point in time, I started reaching out to medical providers for my patients on their behalf. And I
Mhm.
said, I think your patient needs a rheumatological panel. They've got arthritis in the jaw. They probably have other areas that need to be explored.
Mhm.
And I met a lot of resistance with some, but there were the few who were
Mhm.
like, oh my goodness, this is wonderful. I'm so glad that you
Mhm.
contacted me,
Mhm. Mhm.
and
Mhm.
so that's how I started learning to form interdisciplinary teams.
Mhm. So nowadays, are you seeing mainly TMD patients? That became a specialty for you. That became your,
Yes.
yeah. Yeah.
That's my focus. I like to say I do orthodontics as a hobby
Mhm.
because that was something I enjoyed,
Mhm.
but around that time, around 2012, I just started getting more and more involved with TMD and um, advocacy research, clinical care, education, the
Mhm.
whole, like, kind of, it
Mhm.
just became my passion.
Uh-huh. And I think that chronic pain can be something that pushes people to desperation, right?
Absolutely.
And chronic pain for many, many years, that the amount of people that have some kind of chronic pain where physicians have no clue and patients have no idea where to go, right? Luckily, you were a dentist and somehow you found the connection and you were able to explore the solution. So if what type of patients are you seeing? What type of problems these patients they're coming to you? Are doctors starting to realize that they need to collaborate with dentists like you? How is this whole environment at this point?
I think there is some momentum building.
Mhm.
And in my clinic, I usually see patients who um, they've seen a lot of other providers before they get to me most of the time. But what I find is that when a patient comes to me and expects that they're only going to get 15 minutes with me, and they find out that we have a lot of time reserved for them,
Mhm.
this opens up the communication,
Yes.
and there's the saying by the father of modern medicine that if you listen to the patient, they are telling you the diagnosis.
Mhm.
So that's the first thing that I do is let them share with me
Mhm.
what
Mhm.
they're experiencing,
Mhm.
what has been done for them that has helped or hasn't
Mhm.
helped. And then we really start to try to get the primary care doctor involved in the conversation, the
Mhm.
rheumatologist, the ENT, the neurologist, anyone who's helping them with the coexisting chronic overlapping pain conditions. And I actually recently started working with a group who we put together workshops for patients with ancillary providers like physical therapist, a
Mhm.
speech therapist, a nutritionist,
Mhm.
a
Mhm.
behavioral health specialist. And
Mhm.
so then the patient starts to understand, there are people who can
Mhm.
help me help myself as well, and when they have that sense of this is not hopeless,
Mhm.
uh,
Mhm.
it just really opens,
Yeah.
opens the door for improvement all around.
I think you touched a very important point, allowing yourself and listening, time and listening. And unfortunately, modern medicine moved away from that. And here in US, even more. And of course, we all know that unfortunately, the business model behind it is pushing people to act in a certain way, right? Um, how can we reverse this? How can we create a system that is connected, that is not in a rush, that is there to listen, and it's there to care?
Mhm.
I don't,
Mhm.
if most of the time, if I go to a physician, I don't, it, I don't feel they care. And many times I think that they're not a bad person. That it's just the system that is not allowing them to care and to listen. They give us a suggestion or they give an answer before even listening to me.
That's so true. Yeah, I actually heard someone say, I think it was in another TEDx talk, someone said that the average amount of time that a patient can speak before they're interrupted is less than 2 minutes. you know,
Yeah, crazy.
because there's this time constraint and it's
Uh-huh.
unfair to the provider and it really is harmful to the patient. I
Mhm,
think we need a paradigm shift, and
mhm,
I know that we do,
mhm,
honestly. I don't know if you read the report that came out in 2020 from the National Academies of Science, Engineering, and Medicine, but they did a wonderful report that got released at the exact same time that COVID hit. So
mhm,
it didn't get the attention that it deserved.
mhm,
But they talked about what is necessary is that multiple stakeholders need to engage
mhm,
across education, research, the payer system, private
mhm,
and public insurance, you know,
mhm,
that all of these areas have to be revamped.
mhm,
And
mhm,
that's not an easy thing. You know,
mhm,
I had a good friend who was a patient advocate for 40 years. And she said if she were trying to solve world peace, she could have done it by now because
mhm.
this is such a problem, you
Yeah,
know,
yeah, yeah.
and so people who care have to speak up, and
Mhm,
people who don't care should listen at least to
mhm,
see why this doesn't matter to them. You
mhm,
know,
mhm, mhm,
maybe they've been fortunate enough to never have a chronic
mhm,
pain condition, but
mhm.
most of us at least have had a loved one or
Yeah,
someone we know. And that's why it should matter to them.
yeah.
And that's why we really do need to change the
Mhm,
system
mhm.
to an interdisciplinary, whole
100%.
person type of care.
And interdisciplinary beyond, beyond dentistry, I know that every Congress we go, interdisciplinary has been for the last 10, 20 years a fancy name that everybody does interdisciplinary dentistry, but it's so shallow, it's so limited, right? I do agree that medicine and dentistry in general are going through a crisis and a critical moment, but every crisis brings opportunities. And don't you think that dentistry has right in front of us a huge opportunity? Because we know on research as well that people in general, huge majority of the population see their dentist much more than they see their physician, right? And
Exactly.
usually for some reason, the dentists usually have a better relationship with the patient than the physician. Maybe because the dentist does have a little bit more time because the dentist is performing something and talking to the patient that is there sitting.
Mhm.
So there is, of course, there's not the opportunity to listen that much, but at least you are creating a relationship and you spend hours with people, in the chair, in the room. Um, so I think that for the first time ever, dentistry can actually push medicine and not the opposite, right?
Right. I agree with you. I would say though, you know, in dentistry, we tend to be like fixing something. We
Yeah,
tend to be mechanics, you know,
yeah.
we see decay, we remove decay, we plug it up, and the
Yep.
patient goes away happy because they feel
Mhm.
better.
Yep.
But with problems that are chronic, that's not that doesn't work. So I
No.
think dentists also have to learn, um, put your handpiece down, you know,
Yeah.
don't try to write a prescription,
Yeah.
just listen,
Mm,
right?
yeah. Yeah.
We talk while they have their mouth open and they
Yeah.
can't answer us.
Yeah. Yeah.
But as you're saying, we do have an opportunity as we move forward, especially now that that orofacial pain is trying to bridge the gap kind of between dentistry and medicine to some extent, that we can say, you know, we are doctors. We dissected a human body in dental school. We understand systems, and
Yeah.
we need our medical counterparts to look
Mhm.
at the mouth, not ignore it, right? Look, they tell you to open your mouth and they shine their little light in and then they move on. Because I mean, I talk to doctors every day, and here in the neurosurgery department, I say, what did you learn about oral health? And they said, we learned that was for the dentist.
Yeah, yeah.
Right?
And that's the problem of diagnosis, right? What I, what I try to tell people is that you don't need to be an expert on everything. It's impossible to be an
Yeah.
expert on everything. You may choose to be a super expert on X, Y, and Z, and on these topics, you can actually act
Mhm.
and treat the patient from A to Z on those topics. But somebody on your team needs to be the diagnostician. And if you want to become the diagnostician on a first appointment, you need to remove your expert hat and put your generalist hat on, right?
Yeah.
Step back, listen, spend time, and try to connect the dots of the whole body. And as we mentioned, we don't have much education on that, and we need to kind of learn here and there and kind of independently, unfortunately, evolve on this topic. What do you think we can do? How do, for dentists that are listening to us and saying, I like this topic, what are the simple things that I can start changing? And I mentioned to you that I think everything starts on the first appointment. We need to
Mhm.
reinvent the first appointment.
I
Uh,
agree.
a holistic dentist like you, how your first appointment works. What do you actually do on this initial moment? What do you explore?
So I don't look inside the mouth initially. I ask questions. We have the patient fill out a health history, a review of systems. We talk about what is the problem, what systems are involved, why have you come to see me today?
Mm, mm,
So we start with that. And then we look at we do a very thorough exam. So
mm,
when we ask a question, each one of the questions in our exam has a reason for it.
mm,
Like if
mm,
I
mm,
ask them, do you have ear pain?
mm,
I'm exploring how the ear pain is related to
mm,
their chief complaint.
mm.
Do you have headaches? I ask them about all of these things that they sometimes say, I didn't think that had anything to do with this
Yeah, yeah,
you
yeah,
know but
yeah.
we like you said, we're connecting the dots. And so
Uh-huh.
I think that dentists need to learn how to do an initial exam, and that's
Mhm,
actually something that I teach. I
mhm.
developed a 2-day course where
Nice.
I start at the very beginning, actually, with anatomy, because we
Mhm.
need to review the anatomy of
Yes.
this area.
Yeah.
And then we go through everything that's necessary to come to a diagnosis, because
Mm.
I see dentists and physicians who start doing things before they actually have a diagnosis.
Yes.
And,
Oh,
and
yeah.
if our diagnosis is incorrect or absent, we'll have very incomplete or disappointing
Yeah.
results.
The problem is that patients come to dentists with problems that they don't think the dentist can help them. So they have
Mhm.
no clue. And the dentist doesn't explore beyond the obvious. So the patient has chronic pain. The patient doesn't know that the dentist can help. The patient goes to the dentist because of something else. The dentist sees the decay, treats the decay, and says, I did a great job, and
Mhm.
missed the opportunity. We see that, we talk about airway. We miss opportunities every single day about airway, sleep quality, breathing quality is right in front of the dentist. The dentist is not seeing, and just interventionist treatments are done to fix the superficial problem. We see that with chronic inflammation, people that come with chronic inflammation on the bone, on the tissues, huge impact on general health right in front of us. We don't see it. We don't even explore it. We see that even with signs for diabetes and heart disease, issues that are causing long-term dementia and Alzheimer connected to the mouth. We don't explore. we don't see, we don't talk about it. Patients have no clue that we could help them. And even worse, physicians are not exploring our knowledge to help them with those diseases as well, right?
That's right.
We don't explore the saliva. We don't test saliva. We don't do blood tests. We don't see the levels of vitamin D that the patient is coming. We do surgeries. We extract teeth. We place implants with patients that are not stable on basic things. We have no clue about the relationship between bite and posture. It's just insane that dentists are changing people's bite, opening the bite, restoring the posterior teeth, adjusting the bite, and not even questioning the connection between the way you move and the way your jaw moves and the way you bite and the way you stand up and this. So it's a completely disconnect, right? So it's impossible to be an expert on everything. And I think that in your case, since you're well known for this, more and more patients are coming to you because of this, maybe, right? Or they're coming. So what can you say to a general dentist that patients are coming to them not because of these topics at all? So if you were not you, if you were disguised working on a GP practice, they're doing first appointments, with all these patients coming every day to you without knowing who you are and without knowing that they are there because of something, what would you do? What would you incorporate into a first appointment of a general practitioner? So it's not your practice, because your practice is now special because you're well known because of this. But if you are bringing this to a GP, what are the signs and questions and symptoms and things that could give them a hint? Say, hey, wait a minute, I'm not going to do 10 veneers on you. I think that there's more important issues to explore here.
Yes, that's an awesome question. So the dentists have to ask better questions to get better answers.
Yes.
They have to ask the patients, how are you sleeping? Do you snore? Do you have, stiffness and other joints in your body? They have to spend a little more time on reviewing the big picture. Don't pick up the handpiece. Don't have the patient open their mouth. First, ask them some questions that every patient needs to be asked. And with a new patient exam, you have the opportunity to look at everything that you may not be an expert about, but that you could refer to someone.
Yeah.
So like your
raise the yellow
example,
flag. Yeah, raise the yellow flag,
your example about posture, if you see that when the patient walks in, you're watching them walk to the dental chair and you see a forward head posture, or you see these dark circles under their eyes and they're breathing through their mouth, refer them to a speech pathologist or a oral myologist, refer them to a physical therapist, have the referrals ready.
So you need to build, the key is to build the network. I think dentists should leverage a network, on all these topics we talked about. You need to find the experts beyond just the perio-ortho surgeon that you have. So you feel, and then you need to learn from them, how to detect the signs.
Yes.
And raise the yellow flags and say, look, I need to refer you. I know you came here because you want to align your lower teeth, and we can do 3 months of aligners and fix that. But there are underlying problems here. There are hidden problems that will change your life in a much deeper way. And I think that this is the challenge, because I feel like dentists are afraid of scaring the patient or exploring topics that the patients are not there to explore, right? The dentist, the patient's like, I just want you to fix this. What are you talking about? So I think the challenge here is that we need to help dentists on how you bring this topic. Say, I know you're here because you want 10 veneers, but there may be issues way more important that you don't even know you have, or you have the issue and you don't think I can help,
Mhm.
or you don't feel the problem yet, but the problem is right around the corner, and I can see the problem today and help
Yeah.
prevent the problem from happening.
Right. I tell patients that, if you want veneers, it's kind of like if you had a house with structural problems
Yeah.
and you're just going to put some paint on the walls to
Yeah.
try to hide the structural problems. It's
100%. Yeah.
not it's not that we don't know how to do it, but we want to help you with your overall health and
Mm-hmm.
well-being. And I
Mm-hmm.
think that to go back to something else that you were saying, dentists are comfortable with the concept of lunch and learn. They have like the toothbrush rep will come do a little lunch and learn about these are the new toothbrushes and these are the new toothpastes. They can do these same kind of things with the ancillary providers in their community. So,
Mm-hmm.
for instance, I have a speech pathologist that I work with. We go to different dental offices and teach the dental practices. This is what you need to be looking at with your
Mm-hmm.
patients: posture, cognition, sleep, speech,
Mm-hmm.
all of the things that the patient may not think that's what they're going to the dentist for,
Yes.
even
Yes.
though the dentist needs to know something about it, right?
Mm-hmm.
But
Mm-hmm.
if the dentist says, "Hey, I'm recognizing these things, I want you to go see my colleague who can
Mm-hmm.
help you."
Mm-hmm.
Um, I do this all the time, especially with physical therapy, because I have a lot of chronic pain patients who
Yeah.
they may be telling me that their jaw hurts, but when I also find out that they have neck pain, and I
Mm-hmm.
say, "Okay, my physical therapist can help you with your neck pain, which is also going to help you with your jaw pain."
Yes.
And then they come back and they're like, "It's a miracle. I feel so
Yes.
much better."
Yes. But it should be so obvious that we know that if we have an issue here, it is affecting here, that somehow we are trying to compensate this that may affect the muscle here. So if you're doing aligners on the teeth, or you're doing veneers, or you're doing a single crown, GP kind of dentistry, it makes no sense for you not to touch here the patient and say, look, this is not proper, right? This is not good. We need to see a little bit beyond. And that's why I think it's an amazing opportunity. I get excited. I'm not an expert on none of these topics. I'm learning how to raise the yellow flags. By the way, I would love to do your course. I want to tell me more about your course.
Oh, awesome. Yeah. So we're going to hold it in Orange County, California, March 15th and 16th. It's with McGann Postgraduate School of Dentistry. And we'll also have a live stream option for people who aren't able to travel. But
Mhm.
California is a nice place to go in
Oh,
March,
yes. Uh-huh.
Especially where I live, it rains all the time. So I love
Uh-huh.
to go down to sunny California. But it's 2 days, and we have some hands-on exercises where we palpate muscles and we measure range of motion. And I teach some things like trigger point injections, which are really helpful for
Mhm.
um, for like myofascial pain,
Mhm.
especially like patients who have referred pain.
Mhm.
We look at a lot of cases together so
Mhm.
that we
Mhm.
can help develop the diagnostic skills. So we
Mhm.
look at
Mhm.
cases and we say, what could have been done differently?
Mhm.
How would this patient have benefited from X, Y, and Z?
Mhm. Mhm.
And then we hear some patient voices,
Mhm.
so there are some videos where
Mhm.
patients tell their story, like
Yeah.
this is what happened to me, and how maybe they feel the healthcare system
Mhm.
let them down, so
Oh,
that
yeah.
we can learn from that,
Mm.
because
Yeah.
patient voices are very
Yeah.
powerful, and that's a great way for us to learn.
Uh-huh.
Their
Uh-huh.
stories will stick with us.
Mhm. Mhm.
Yeah,
Mhm.
so yeah, I would love to have you. It would be
No,
an honor.
we will definitely we will talk later on how to help you promote this to our network. I think that every general practitioner should explore this. If you could guess the percentage of patients coming to a GP practice or a restorative practice that could benefit from this know-how, that have no clue that they could, right? If you could
Mhm.
guess a percentage, you know, on a
Well, I mean, personally, I think every patient could benefit, but I did learn that 1 in 6 patients that presents into the dental office is presenting with pain.
yeah.
And the most common is dental caries, and the
Mhm.
second most common is temporomandibular disorder.
Yeah.
So that tells us a lot. You know, we know that 10% of the population has this type of pain to some degree. And
Mhm.
that's 35 million people in the United States. That is a lot of patients.
Yes. Yeah. No. So if people were looking for a number that represents the opportunity as well, even in terms of business, you know, in terms of
Mhm.
delivering better care and growing your practice because of that, you know, and word of mouth probably goes very, very fast, huh? When once you start touching these points,
Mhm.
you
Oh,
know,
yes. Mhm. I
how do
mean,
you
I
get?
have patients who come to me from Canada and Virginia and I had one from Alaska
Mhm.
yesterday. And I love to help people, but what I would really, really like is for them to have someone in their community who could do
Yes,
this for them as
yes.
well.
That's why we need to spread the word. And
Mhm.
so besides your course that we definitely need to push and spread the word 100%. What else can dentists listening to us that are enjoying this topic, what else they could do, you know?
I I think they can read, you know, there are some great textbooks available that some of the textbooks go into too much depth, but there are others that give a nice overview. And then one thing that I like to do is I just search for topics. For example, a lot of TMD patients also have headaches. And so the Association of Migraine Disorders has some amazing explainer videos that you can
Mhm.
watch, and they even have a course that you can take online. It's free, and it teaches about like headaches attributed to TMD, migraine headaches, tension type headaches, trigeminal neuralgia, you know, things that we need to know a little bit
Uh-huh.
more
Uh-huh.
about.
Uh-huh.
And when you watch an explainer video, it helps
Mhm.
you, it helps that
And
concept.
you're talking about YouTube videos.
Yes, these are actually online on a website called the Association of Migraine Disorders.
The
Um,
Association of Migraine Disorders, and you can
yes,
find these videos.
yes.
Yes.
And I'm hoping that in the future, I'm going to create something similar to this
Mhm.
that's going to
Mhm.
be more targeted toward dentists
Uh-huh.
so that if they want to learn more, they can study on their own time.
Fantastic. And the book you mentioned, there's a few books, but which one, if you could pick one book and suggest, do you have it on top of your mind?
Yeah, I would say probably Dr. Okeson's book. I'm gonna have to look at the title. I think it's Temporomandibular Disorders and Occlusion. That
Uh-huh.
was the original title. But one thing that I do like to point out is that occlusion was what we thought we needed to address in the 80s and 90s.
Uh-huh.
And we now know that that's much less of a
100.
focus.
100.
And that's why my course is called 21st Century TMD Protocols, because I know from my own experience, I was
Mhm.
harmed by things we were doing in the 80s and 90s that we
Mhm.
now
Mhm.
know are not evidence-based.
Mhm. Mhm.
So we
Mhm.
have to be humble enough to
Yes.
learn from our mistakes and to
Yes.
say, maybe this is how I did it when that was all I knew. But
Mhm.
like Maya Angelou says, when you know better, you do better. So
Yes.
yeah,
Yes.
I love his book, and I
Mhm.
love that he has changed it over the years to
Mhm.
keep it more current
Mhm.
and to take the focus away from occlusion so that
Mhm.
we're looking at all the other factors, the
Mhm.
multifactorial etiology of chronic pain and facial pain.
No, always evolving, yeah. And
Yeah.
yeah, I think that where can people find information of your course? There's a website or
Yes, there's a website. It's McGann Postgraduate School of Dentistry. I'll give you the actual website link because
Mhm,
I don't have it memorized.
mhm,
So
mhm, mhm.
yeah,
Now we
it's
will share the link on the podcast for sure.
okay. Thank you so
Uh,
much.
but
Thank
if
you.
people Google your name, probably they can find information,
Yes.
of
Or
course.
if they Google 21st century TMD protocols, it comes right up.
21st century TMD protocols. That's easy to memorize. I like. Suzie, great pleasure. I really think this topic is so important, and maybe in the near future, even schedule another discussion, maybe more in depth in some of these topics. I really mean it, that I want to spread the word. We have a very big community, and many people want to provide this more holistic type of care. You know, they want to become identifiers of issues, and they want to create a network with specialists that can actually treat patients, you know, on all these topics. So I hope that we can further discuss how to collaborate more in the future. And
Absolutely.
yeah,
That would be
yeah.
delightful. And I'm
And,
so happy to have met you, really,
no,
Christian.
no, and hopefully in person soon, so we can continue to discuss our passion for this topic as well. And I just want to finish by asking you, you know, what inspired you to become a dentist at the beginning of your professional, when you were choosing a profession, and what continues to inspire you today to continue to be a dentist?
Well, the answer is it's probably not what you would think, but I come from a line of physicians. Like everyone in my family was a physician. So I always thought I would go into medicine and I thought I would be a pediatrician. But a good friend of mine who I grew up with applied to dental school, got into dental school a year or two before me. And she said, you should just apply to dental school and see what happens. And so
That,
I did that.
yeah.
And I saw children for the first probably 15 years of my career. I spent a lot more time working with children. Um, and because I just really enjoy kids. But as my condition of my jaw got worse and worse, it really pushed me into the area that I focus on now.
Mhm.
And because I can empathize with people, I think they're just comfortable with me,
Yes.
and I'm able to share with like um, advocacy and
Mhm.
policy groups as kind of a unicorn, a
Mhm. Mhm.
patient
Mhm.
and a provider. So it's funny how, your path may be a little different than you
Yes,
expected it to
of
be, but
course.
it can be exactly what you were meant to do. That's what I believe.
And looking into the future, what excites you the most about our profession when you think about the work that you still have to do for the next, 5, 10 years?
Well, what really excites me is when I meet young dentists or dental students who say, hey, I really want to learn this. I do want to take care of my patients. I want to know um, things that I can not only learn, but once I've learned it, I can teach it to other people.
Mhm.
So
Mhm. Mhm.
I see a lot of that, and it
Mhm.
and it really makes me happy because I do think that the younger generation
Mhm.
is they have a little different mindset,
Yeah.
from the way that they've been raised in this new world of digital,
Mhm.
technology and things that make it easier for us to acquire knowledge and information.
Mhm.
So
Mhm. Mhm.
that's something I'm really excited about.
No, I agree with you. I really trust on the next generation, and I can definitely see them doing better than us. And it's our job to just share everything that we learned, to give
That's
them the
right.
shortcuts so we can move forward and deliver better care, even more comprehensive, more holistic, more integrated. And hopefully in the near future, dentistry will be seen by the medical world in a completely different way. The way
I
when
think so. I do think so. I think like I said, the momentum is there. We have to just keep talking about it,
Yeah,
keep,
that's
keep
it.
bringing it to the forefront.
That's it. And that's why I congratulate you once again for your TED Talk. That's very brave, and that was amazing, and it allowed me to get to know your work. And let's keep moving.
Okay, thank you so much, Christian.
A pleasure, Suzie. I hope everybody listening enjoyed, and we will definitely have more on this topic since it became our main topic, the oral systemic link, seeing and understanding beyond the obvious. Thank you, Suzie. We stay in touch. Thank you,
Yes,
everybody.
definitely.
All the
Okay.
best.